Hi there. Welcome to this week's episode of Waste 360's Unpacking Recycling with Charlotte. My name is Charlotte Dreisen, and I am so excited to dive into the topic of COVID and how the pandemic has impacted trash and recycling and the solid waste industry over the past few years. There are no shortage of impacts that have been large and small, really starting from the very first week or two of the pandemic and of lockdowns in March 2019, if not earlier in some communities. But we're going to be talking all about where the waste that we produce has changed, what kind of materials we're generating now versus just a few years ago. We're going to talk about the full range of PPE that we're now producing in our homes where we may not have if we aren't healthcare workers in the past, as well as how recycling programs, both public and private, have had to respond to the staffing shortages and supply chain disruptions of COVID. We're mostly going to be looking at examples from the US, but we'll try and work in a few from different international perspectives, knowing it varies so much from place to place, as well as within the US, from dense urban cities to suburban and exurban communities. But starting with one of our biggest cities and the experience in New York just as the pandemic was unfolding, New York really saw an incredible plummeting of the waste that was being generated in the commercial sector. This makes a lot of sense. Folks were sent home. Folks weren't working in person in offices once lockdown started for the most part, unless they were essential workers, unlike those in the solid waste and recycling space, for instance. But really, within the first 2 weeks of the pandemic, New York saw its commercial waste plummet 75%, which is such an enormous portion. I mean, the impact of where trucks are being sent on roads is tremendous. And that 75% wasn't equally increased in the residential waste in New York because so many folks commute into the city and in cities in general. So while folks were commuting in, driving in, taking the train, etc., into New York to work, buying lunch, generating food service waste and printer paper waste at the office, those folks were heading back to their home jurisdictions rather than heading home often to elsewhere in New York. So as a whole, in the residential side in New York City, there was an increase of tonnage from 3.2 million tons to 3.4 million tons, about 6% that they observed year over year with that change. So a pretty small increase, but an increase nonetheless. But even that wasn't universal across all communities within New York City. Some parts of New York City actually saw decreases in their residential waste. And this was in more affluent communities where people had the opportunity and the means to head out of the dense urban area and take up residence somewhere with more breathing room during the worst and heights of COVID. So in Manhattan, for instance, 22% reduction of waste that was being generated was observed. And in Greenwich Village, in one of the wealthiest areas of New York City and in Manhattan, a 35% reduction in the waste that they were generating was observed. Conversely, in most of the outer boroughs, increases were seen of 5 to 10% in Staten Island, in the South Bronx, in Queens. One really great anecdote from a large apartment building in Queens was from a concierge from a doorman building where they observed about 40 to 60 packages would typically be delivered pre-COVID, pre-pandemic on any given day. And once the pandemic started, that ramped up real fast to about 200 packages a day being delivered. So not only is the amount of material shifting in terms of where we're generating it, more at home, less at work, but also qualitatively, a ton more cardboard. There was a 5% increase in that community of waste overall, but a 20% increase in the cardboard that they were generating from online orders and from, especially grocery delivery and for other household goods, day-to-day products that we all consume that folks were hesitant to go in person and shop for. But of course, that's not the only kind of material that we've seen an increase in. While cardboard has been one of the biggest, most universal increases across the board, across communities, this community in the Bronx, for instance, who had a similar 20% increase in cardboard, saw a 48% increase in glass, metal, and plastic containers. So a lot more recyclables being produced as a whole. Unfortunately, there was a dip in the amount of recycling, the diversion rate that New York City had. So even though they were generating 6% more waste and a lot more recyclables, there was a drop from 8.5 to about 16.5 in their diversion rate of a couple of points, which is something that I still don't really truly understand myself, why folks would be less successful necessarily at recycling than they would be even though they were having an increase in the amount of recyclables that they are producing. As a whole, the New York City residential waste stream is about 2/3 recyclable. So we know that folks are, on their best days, maybe separating about 1 in 3 pounds of recyclables that they're generating. But this trend is observable, throughout the US, that more cardboard and more containers were being generated at home from folks ordering out food more food serviceware and beverage containers than they had been. One noticeable trend as well is that a lot more glass and clear glass has been generated, which basically translates to clear beer bottles, liquor bottles, and wine bottles. Folks drinking a lot more at home and having a corresponding increase in those kind of containers that they're reckoning with on the back end in their trash and recycling bins. Outside of the US, in Brazil, they saw a 25% increase in the amount of recyclables that they were generating. But unfortunately, due to staffing shortages throughout COVID, many big cities had to cut their recycling programs entirely. Of course, municipal solid waste, our normal trash and recycling, also isn't the only kind of waste that we've been contending with during COVID. The rise in healthcare waste and medical waste has been humongous. WHO estimates that globally about a 10% increase has been observed over the past few years. In many big cities, in Jakarta and some Asian megacities, there's been a 500% increase. And unfortunately, only 1 in 3 healthcare facilities globally have safe, efficient means to manage medical waste and hazardous waste. In the US, that's not something we need to be so concerned about. There aren't hospitals openly burning hazardous waste here in the US, but in a lot of the global south and in the industrializing world, that can be the case, which is particularly problematic when you're dealing with hazardous materials and medical waste, even though, of course, we don't want to be openly burning any materials whatsoever. In the US, though, a really big increase in medical waste has been observed as a whole, too. And a lot of that is for PPE. Of course, the medical community has always been generating PPE, and something that hospitals and clinics, you name it, have always had to contend with. It's a really big cost source for hospitals. Managing medical waste and hazardous waste is an expensive ordeal, and it's something that is really hard to recycle as it's not separated on the front end. So while we think about and are more familiar with all of the challenges of separating curbside recyclables in your standard MRF, in your standard recycling facility, the same kind of sortation principles don't apply to weird, wonky hospital and medical products. You wouldn't be able to just drop a load of medical products onto a sort line the same way we do for consumer packaged goods and be able to easily sort it on the back end. But there are some efforts to think about how we can recycle PPE, and it's different. The outlook looks different for whether you're at home or whether you're in a medical facility. But also thinking about the kinds of materials that PPE is made of is a helpful place to start. So PPE ranges from plastic gloves and single-use masks to reusable masks and visors. Entire single-use disposable suits as well. Maybe you've worn those if you've done a waste sort or have happened to be in an ICU or surgical unit in the past. But it's really a huge, big, complex, wide range. I think most of us at home on a daily basis are probably generating single-use masks, maybe not that bigger, more diverse, comprehensive scope of PPE, but little of it is recyclable. A lot of it's made of materials that aren't easily processed, certainly not without sorting on the front end, and certainly not in our curbside recycling system. I've got to say, in the past couple of years doing, lots and lots and lots of following of recycling routes in DC, definitely see single-use disposable masks in recycling bins with some frequency, not as bad as I would have thought necessarily. So I'm glad contamination, at least in DC, hasn't been humongous. But I'm curious to others' experiences too, if that's been the case. For many folks, I know some communities certainly have seen an uptick, and we all have seen a big increase of PPE in litter without a doubt. So folks really ought to be always placing PPE in the trash. Certainly if it's from an individual who is sick with COVID, most communities in the US have recommended that if someone is sick with COVID, to double bag that waste in a trash bag, place it in the trash bin, even if they've handled items that can be recycled, to place them in the trash, just as a overly cautious approach to ensuring that material and there's no surface transmission, introducing anything negative back into the recycled paper or plastic material supply as a whole. But thinking about the material that plastic gloves are made of and single-use disposable masks are made of, it's simply a complex mix of materials often. So single-use disposable masks are made of non-woven polypropylene. Most often they have a metal noseband, they have elastic ear bands, a complex mix of materials. And honestly, that's not so different, and it's a soft, flexible format, to go over your face. That's not so different from multi-laminate pouches and coffee packaging that you might have on your shelf in your kitchen. It's made of of different layers of plastic and has metal components that are really hard to separate. They're also flexible and soft and are not rigid formats that can be easily sorted by the curbside system. We also, of course, have the concern about the hazardous and biohazard element of being infected with COVID or anyone's, health-related impacts there. And that's a really tricky area to navigate. While in early COVID, lots of grocery stores, for instance, stopped allowing reusable bags due to concern of surface transmission. Likewise, there's a similar concern about COVID being imparted on recyclables, whether it's something we can recycle today, like your conventional consumer packaged good items, or their dedicated PPE channels. Some concerns there. Even though scientists and governments have pretty universally deemed surface transmission as an overblown concern in the scope of COVID, not how the disease normally infects individuals, which is a tricky one and definitely hard to communicate. And out of the myriad of priorities to educate folks with in the recycling space, one that's definitely a challenge for a lot of reasons. But there are some dedicated PPE recycling programs that have sprouted up. There are few and far between. There are not really, as far as I've been able to doggedly research, many communities in the US or elsewhere that have had really standardized, formalized programs to recycle PPE, masks included. The best dedicated channels for mail-back programs that exist today are for single-use disposable masks and some other PPE. A couple great examples are Vita, which creates masks. They are a mask maker, and for much of the pandemic have offered a mail-back recycling program for their own masks. Recently, just a couple of months ago in April, they opened that up and now accept mail-back masks from any brand to process and produce into new masks, which is a really great, mask-to-mask recycling channel. Another one is Reworked, which creates 100% recycled content plastic boards and plastic sheeting from recycled single-use disposable masks and other PPE, has a mail-back program as well. There are some similar programs that exist out there in France and New Zealand, some kind of speckled efforts across the board, but it's really, to be honest, a very expensive endeavor. We have generated hundreds and hundreds of million masks a year over the past few years. A lot of them have escaped into the environment. They really ought to have a dedicated channel for recycling, but many of the programs that exist out there some are only the price of postage that you can mail your masks back to. Others that are more at cost for what the processing actually takes might be $70, $80 or more for a box that might be the size of your kitchen trash bin, which is a serious cost and one that might be challenging to prioritize in your household or a given household. Something that would be really phenomenal for institutions, office places, apartment buildings to band together and support in unison. There's some other additional efforts to also process masks back into functions that would be, have less human contact to avoid that stigma, even if it is not necessarily 100% founded of hazardous concern. So some efforts to design durable goods and bricks and furniture out of single-use disposable masks to process down that polypropylene and create products that, aren't going to be necessarily needing to be in food contact or on people's, touching people's skin, knowing there's a lot of concern about the solubility of materials with those contacts. So it's exciting to see more efforts starting to come around, but they really are few and far between, unfortunately, and are not items, of course, that can be accepted in the curbside system. Test kits are really in the same boat. Not too long ago, I did a post about how to dispose of each item in your COVID test kit, and essentially only the box and instructions for any given COVID test kit are recyclable. All of the components for test strips, for droppers, for nose swabs are unfortunately some combination of being too small, under that 2x2 inch size threshold we have for the curbside recycling system, are made of a complex mix of materials like the test strip, which has plastic, and then the non-woven fabric to absorb the drops from your test, as well as the nose swab itself. The packet that it comes in might be plastic and paper combined. So unfortunately, those items are really challenging to recycle as well. Definitely have seen those in some of our blue bins in DC, and the same goes for other communities as well. So unfortunately, those are another nut to crack, and would be exciting to see some opportunities to recycle those with, the same places perhaps that you go to pick them up in public libraries or other public agencies. But it's a tall order to ask your public agencies to find circular solutions for PPE and COVID test kits when they are so prioritizing, getting folks tested, getting tests into the hands of individuals as well as PPE, especially their own staff. Recycling programs, both public and private, have been struggling extraordinarily with keeping up with staffing shortages and folks getting sick from COVID or waiting on COVID tests and not being able to work after exposures. The experience has varied hugely from city to city and even within city in different agencies, but needless to say, it's been an incredible challenge. A couple examples of some big cities that have been, relatively consistent and have not had to suspend services meaningfully are here in DC, as well as New York. In DC and New York, we've probably had, up to 25% of folks out with COVID on any, given of the worst peaks and worst periods in the pandemic. In New York City, they were able to not suspend or delay any recycling services due to canceling collection workers' days off around the holidays and, forced overtime to ensure that routes get covered, which is not fun for anyone, but has been one way they've been able to maintain that level of customer service. In contrast, there have been a lot of programs, recycling programs in the US that have had crippling levels of COVID positive tests among their collection crews. In Atlanta and Baltimore, for instance, in the worst of their peak about 6 months ago, in late 2021, in December, early 2022, they had more than half of their collection crews out testing positive for COVID. And to think about how to manage a city's trash and recycling with less than half of your team to do it is an incredible challenge and a communications issue to your residents, and a real challenge for staff, of course, who are trying to keep up, especially during the busiest time of year. I think many of us, those who have worked in the industry on the back end, on the receiving side as a hauler, or in a recycling facility or trash facility, or on the public side, know that the amount of waste that is generated around the holidays is absolutely bonkers and really challenging when you are fully equipped to pick it all up, let alone when your team is down 50% of its collection crew members. But it's something that has existed for a really long time in the pandemic, the issue of keeping up with staffing shortages, not just this most recent wave about 6 months ago. In 2020 in Baltimore, they had to stop recycling collection for an entire 5 months. They've since brought it back, but in this most recent wave 6 months ago, have had to drop down, unfortunately, from collecting recycling every week to collecting it every other week on an A-B schedule to ensure that they're able to pick all of the trash up and deprioritize recycling just to make sure everything is getting picked up at the curb. Which is an unfortunate, situation to find oneself in, but a really creative approach to working around staff shortage issues. In contrast, they've been able to stand up a number of collection sites, public collection sites, to give folks additional opportunities to drop off recycling, which has been, I think, pretty impressive. Pre-pandemic, on an ambient level, they have 5 community collection drop-off points for recycling. They've been able to stand up an additional 8 during this change, where they've gone from a weekly to a bi-weekly schedule. So folks in Baltimore now have 13 recycling drop-off centers to pick from to bring their material on their off weeks or whenever they have overflow. In contrast, in DC, we only have one. We have one today, and we've only ever had one, at least in recent history. So that's a really incredible amount of access that's being provided on their feet in a pretty quick time frame. They've hired on third-party help to do that, and hired on third-party help from haulers to help collect trash and recycling, to kind of patch the staff shortages they've had. Atlanta has done the same thing, getting 4 temp agencies on board to help supply up to 50 collections crews workers. 50 collection crew workers to patch their staffing shortages too. But the situation has really been pretty universal. There are a slew of instances ranging from Nashville suspending recycling from a matter of months, from Louisville. New Orleans, unfortunately, was coming off of Hurricane Ida, where they had to suspend their recycling program due to the natural disaster they experienced. And then just as they were planning on restarting their recycling program over the holidays, unfortunately had to delay that further due to COVID COVID-related staffing shortages of collection workers testing positive. A couple reasons why this has been so severe is that A, it is really hard to socially distance when collecting trash and recycling when you're in the cab of a truck. It's passenger and driver seat. There are not a lot of places that you can go. Hopefully folks are masked. That's definitely a recommendation of most public works departments and sanitation departments, but we know that compliance can be tricky with folks in collection crews and in city agencies and humanity as a whole. Another reason this might be particularly severe for collection crews is that often public works departments and sanitation departments have some of the lowest levels of vaccination rates among any city agency. Certainly in DC, that's the case. The DC Department of Public Works has, I believe, the second lowest vaccination rate after MPD, after the police department. Very, very low vaccination rate, unfortunately. In Baltimore, the situation is really similar. 56% of their staff were vaccinated. The rest were unvaccinated. So when you also think about transmission in a tight, confined space among folks that may not be meaningfully vaccinated to kind of a really big majority, it does, 1 + 1 does kind of equal 2. And a lot of cities have required frequent testing if you haven't had vaccination or aren't fully vaccinated. But definitely thinking creatively about bigger incentives to ensure folks are getting vaccinated would probably be prudent and help insulate collection crews from such big staffing shortages before. Pre-pandemic, your average kind of ambient level of staffing being out on any given day might range from 5 to 12% in most communities. So these are definitely levels of staffing shortages that are 2, 3, 4 times, maybe 5 times worse than we've ever really seen them on an ongoing basis. But definitely compounding that are, of course, natural disasters, hurricanes, tropical storms. If you are in the south, if you are in the north and experiencing inclement winter weather, that's definitely a complicating factor. When you think about how, a DC or a Baltimore who normally doesn't get a lot of snow, but this past winter got maybe 5, 6, 7, 8 times more snow events than we typically have in the past. The same folks that pick up trash and recycling who are now tasked with, driving snow plows and responding to snow emergencies stretches really, poorly staffed crews even thinner. So to keep up with the trash and recycling that you're generating as a city with half your collection crews or maybe a third out sick, and to now also have to reallocate those staff to respond to snow emergencies or other types of weather emergencies makes it even all the more challenging. So certainly that's one big issue, but of course, knowing that we have an increase in residential waste in most communities that has occurred during COVID, even if we were to have fully staffed crews, it would likely be an extra challenge to collect all that material and really difficult to maneuver and create new routes and staff new routes to respond to that with supply chain issues that exist today, with it not being uncommon to have to wait 12, 18, 24 months for a truck and to procure new equipment to accommodate that. So no shortage of impacts that the pandemic has had at a high level, down to the household waste level here in the US and elsewhere. I would be so curious to better understand your experience if you're with a city, or if you are just like me and are no longer with the city, but had worked in the past and are now an average person taking COVID tests and using disposable masks, and how you've been able to reduce that waste in some instances, if you've been able to use some of those dedicated channels and recycling programs for PPE, I would be thrilled to know. Please leave a comment, as always, right below this video on Waste 360's website, or as always, give me a shout on Instagram at Shar Recycles or on Twitter at Shar Dreisen. Thanks so much for joining us for this week's conversation about COVID and recycling and trash. Looking forward to next week's topic. Bye.